Dear professor and colleagues, thank you very much. Good afternoon. It's a pleasure for me to be here with you, and I would like to thank you, Professor Andrew Gams, for the organization, together with the Professor Mohamed Al-Ansari, for the organization of this event, an important webinar on new technologies in surgery. And I would like to thank you also, Professor Matthew Walsh, for this opportunity in Education Committee for the Society of Digestive Surgery, International Society of Digestive Surgery, and for the important Congress of this society in the next future in 2026. It's a pleasure for me to present briefly our surgical experience with Metaverse, but first I would like to share with you some consideration about the new technologies in the health. Today, it would seem that where there is a good communication, there is a good health. And it is to be understood between colleagues, between doctors and patients, doctors and parents, and between doctor and the management of the hospital. So a good communication improves the outcomes of the patient and reduce the cost in the hospital. And this concept has been already proven in research, because until the researchers were divided and locked in their rooms, the progress was slow. But after, with the introduction of translational research methods, with the Skyway, the bidirectional bridge from branch to bed and from preclinical to clinical, today we have an infinite amount of knowledge and information. Who transformed medicine from evidence-based medicine to tailored therapy and precision medicine with multidisciplinary evaluation of the patient, each with their skill. And all this information and data today must be achieved, analyzed, verified, and statistically validated to make them available to the patients and in clinical practice. And in my opinion, for this context, in this context, the new technologies can support the health to have a better result, but not to replace us. In 1957, an American geneticist Huxley defined transhumanism, the man who remains human, but who transcends himself for his human nature. So, to support us, but not to replace us. And based on this concept, we in the past landed on the moon. And today, in the field of the health, the clinical practice is based on the new, on the innovative concept defined design thinking in healthcare, an innovative concept that underlines the importance of multidisciplinary collaboration to solve complex problems. All start with the brainstorm from one of the team members that need to be discussed, presenting a solution, and put into practice so for the patient. In this way, for the new technologies, we focus on the Metaverse because we think that is an effective technology for advantages within the group. Because we can personify ourselves with the avatar, teleported with hologram, we can share videos, presentation, live surgery, 3D reconstruction, for planning and for follow-up. and telementoring for laparoscopic surgery, and practical telementoring for robotic surgery by connecting the console remotely. And we think that is also an efficient technology for advantages outside the group, because we can reduce cost of human and economic resource. In March 2023, we participated in the inauguration of the Metaverse Hospital USA, projecting a cholecystectomy and a laparoscopic left colectomy into the metaverse, discussing, for example, the critical safety view in a cholecystectomy, identification of the calotriangle, isolation and section of the artery and cystic duct, or in a left colectomy, discussing about isolation and section on the origin of the inferior mesenteric artery and vein. On June 2023, we organized also the first hepatobiliopancreatic surgery workshop in the metaverse, sharing scientific presentation from professors of different universities, surgery videos, 3D reconstruction, and live surgery, in particular, a robotic left hepatectomy performed by the Professor Memeo from Hospital of Bari. On February 2024, during the Iraqi Medical Conference, also we performed in the metaverse a robotic right colectomy from Reggio Calabria Hospital and a laparoscopic cholecystectomy from our university hospital. And we can see that after a simple setting of virtual hospital in the real operating room, it's very easy to share and follow procedures, even from your smartphone, for example, no? Finally, we shared also in the metaverse or an immunohistochemical and morphovolumetric analysis for second opinion, for example, or to solve the problem of the shortage of pathologists in the world. We reported our data in scientific publication in Updates in Surgery Journal, Surgical Innovation, Asian Journal of Surgery, and in lecture notes in computer science. And our research activities continue in this direction in our Metaverse Healthcare Research Center, creating a nano satellite cube for the health emergency, or to do robotic surgery remotely in the absence of gravity to make space mission safer, for example. So I want to thank you for the attention, and I want to conclude with this expression of Henry Ford: there is true progress only when the advantages of a new technology become available to everyone. Thank you very much for this opportunity and for this important webinar. Thank you.